know that if someone does divert, like that a patient of mine, well, I picked it up from my college roommate, and I'm like, can't do that, right? But there are significant penalties for people doing that. But he wanted some help. It was finding out. And I said, am I correct on that? There could be criminal potentially these actions.
We do. And I'll point you to a recent article that just came out in JAMA. The Harvard group did a great study saying, how does digital prescribing increase or decrease the rate of substance use, misuse, and stimulant misuse in this case? And the good news is at the Harvard clinic, where they watch people very clinically, very closely, the overall rate of misuse was pretty low. But what they found is if your initial visit with somebody, when you start their ADHD medicine, was done by telemed, somebody was 8 times more likely to have a stimulant use disorder, 8 times more likely. So that's another place, the world we live in, where we tend to do digital medicine, digital interventions. We have a hybrid practice here where we see about half our patients in person, but about half through telemed. We know those patients are even more vulnerable to going on to have a stimulant use disorder, maybe because we don't have the checks and balances with them, maybe because we don't have the same continuity. So I think that's another place where we say, listen, given the evolving nature of healthcare, it's even more important that we evolve our solutions.
So one of those solutions may be seeing patients in person and so often. That's coming, correct? There's been some come back from the DEA and things, right? Am I correct on that?
I think if we don't find a better job of ways to police ourselves and to make sure we're giving safe care to our patients, I think the DEA will step in and they'll police us if we don't do it ourselves.
That's right. So we need, as physicians, we need to work toward these solutions to make sure our patients who do need it can get it the right way.
Yeah. Okay. And that's a place where I want to stress to the audience. We've talked about the limitations of ADHD, but let's talk about the importance of ADHD. When we treat ADHD, we do more to improve health outcomes than pretty much any other mental health condition. Jerry, you know this, the effect size of appropriate ADHD treatment as far as how much we improve symptoms and how much we prevent other mental health conditions is one of the biggest effects in all of medicine. And when you appropriately treat ADHD, you're not just treating ADHD, you help to prevent secondary issues with anxiety, depression, demoralization, falling off the bandwagon and dropping out of school, getting in trouble, financial problems, relationship troubles. So it's a place where appropriate treatment can really make a dramatic improvement in people's lives.
What about the form of the stimulant medication? Immediate release versus sustained release. Does that play a role as well?
It certainly does. And here's another lesson for our audience and probably a take home from the podcast. Short-acting stimulants are only FDA approved for children. No short-acting stimulant ever did safety or efficacy trials for adults. So one of the biggest mistakes I see is people start chasing adults with short-acting stimulant. They come in and say, hey, I tried short-acting this or that from my friend, from my college student, from my next door neighbor. Could I get some of that? And that's a person where right away the red flag should go up. First of all, they've already misused somebody else's stimulant. That's a warning sign. That's a warning sign about future abuse and diversion for that patient. But it's a warning sign that, once again, short-acting stimulants aren't FDA approved for adults. So the FDA has been very cautious about that if you're going to treat adults, they want you to use long-acting once-daily medicines, which have a lower abuse potential. So one of the studies that I'm familiar with, Jerry, and I'll show this to my patients, if you give short-acting amphetamine versus long-acting once-daily amphetamine, long-acting once-daily has about 25% the rate of misuse of short-acting stimulant. So people that tend to misuse like something that kicks in quickly. They like to feel the on and off. When we smooth things out and get rid of that abrupt on and abrupt off, we help to decrease the overall misuse and abuse potential of the compound.